Hello everyone, and welcome to our latest phlebotomy study log. This video focuses on the chapter on blood collection in special populations, and I have 30 questions prepared for us. For each one, hit that pause button and see if you can figure it out before I go over the answer. I hope this helps. Let's get started. Number 1. Crying causes an increase in WBC count or white blood cell. Number 2. Which gauge needle is best to use for a draw on a child younger than 2 years? 23. Number 3. Jaundice means yellowing of the skin. Number 4. Which laboratory test assays jaundice? Bilirubin. Number 5. Neonatal screening tests for which disorders are mandated by the United States? PKU, phenylketonuria, and hypothyroidism. Number 6. Samples for PKU testing are typically collected on special filter paper. Number 7. Which of the following occurs as we grow older? Hematomas are more likely. Number 8. Which of the following is not a VAD, vascular access device? YMLA. Number 9. Blood should never be collected from the arm of a patient containing an arterial line. Number 10. Dermal punctures in pediatric patients are preferred for blank testing. PKU. Number 11. When warming an infant's heel for a dermal puncture, the heel should be warmed for 3 to 5 minutes. Number 12. Which is not a type of CVC, central venous catheter? Fistula. Number 13. An arm containing blank is never used for phlebotomy procedures. Fistula. Number 14. Only specially trained personnel acting on a physician's order are allowed to collect specimens from mentally impaired patients. Number 15. List and explain 5 strategies you can use to help reduce a child's anxiety before a draw. To reduce a child's anxiety before a draw, prepare your material ahead of time. Perform the procedure in a room that is not the child's hospital room. Be friendly, cheerful, and empathetic. Explain the procedure in child's terms. Do not say that the procedure will not hurt, but say that it is okay to say, ouch, and give children choices whenever possible, such as which arm or finger they want to use or the type of bandage they prefer. Number 16. What type of needle may be used for pediatric patients younger than 2 years? When performing venipuncture on patients younger than 2 years, use shorter needles if possible, and use the smallest gauge consistent with the requirements of the tests. Butterflies and smaller tube sizes should be used. If the patient is younger than 1 year, a heel stick should be performed, rather than venipuncture. Number 17. What is YMLA, eutectic mixture of local anesthetics, used for? YMLA is a topical anesthetic cream used in pediatric patients to numb the venipuncture site. Number 18. Name 2 safe ways that a child can be immobilized during a draw. Children can be immobilized during a draw by wrapping newborns or infants in receiving blankets. Older children need to be restrained. They may be seated in the lap of a parent or assistant who hugs the child's body and holds the arm not being used in the draw, or they may be lying down with a parent or assistant leaning over the child, holding the unused arm securely. Number 19. If an infant is under a Billy light, what must the phlebotomist do before collection? Bilirubin is light sensitive. Billy lights should be turned off during collection, and the specimen should be shielded from light. Number 20. How is a PKU sample collected? A PKU sample is collected via capillary stick onto a special filter paper supplied in a kit provided by the state agency responsible for PKU tests. Number 21. Name 4 physical changes that geriatric patients undergo and the phlebotomist must consider when collecting blood. Physical changes in older adults include skin that is less elastic and thinner, a tendency to bruise more easily, longer healing times, more fragile, less elastic, and narrower blood vessels, loss of supporting connective tissue, leading to loose skin, loss of muscle tissue, allowing veins to move from their usual locations, and arteries that are closer to the surface. Number 22. Explain the procedure for drawing blood from a geriatric patient. To perform a draw on an older adult patient, be especially careful with patient identification. Be aware of the frequency of blood draws. Be especially gentle. Do not apply the tourniquet as tightly. Place the arm on a pillow and have the patient grip a washcloth while the arm is supported by rolled towels. Do not slap the arm to find a vein. Anchor the vein firmly and apply pressure longer to ensure bleeding has stopped. Number 23. What is a VAD? VAD is the acronym for Vascular Access Device. It is a tube that is inserted into either a vein or an artery and is used to administer fluids or medications, monitor blood pressure, or draw blood. Number 24. Explain the procedure for drawing blood from a patient who has N4 line. To draw blood from a patient who has N4 line, have the nurse turn off the foredrip before the draw, less than 2 minutes. Apply the tourniquet distal to the 4 insertion site, select a vein distal to the 4 insertion site, and in a different vein, discard the first 5 milliliters of blood drawn, since it will be contaminated with 4 fluid, and on the requisition, note that the specimen was drawn from an arm with N4 and identify the 4 solution. Number 25. List 6 types of VADs. Types of VADs include CVC, Broviac, Grosjean, Hickman or triple lumen, implanted port, PICC, arterial line, heparin or saline lock, and AV shunt, external or internal. Number 26. Name at least 2 psychologic complications a child may experience during a phlebotomy procedure. List the actions you would take as a phlebotomist when drawing blood from a child. In a phlebotomy procedure, a child may experience a fear of the unknown and a fear of pain. As a phlebotomist, you must explain the procedure in detail to the child, using words the child understands. The phlebotomist should speak to the child during the entire procedure, letting the child know how much longer the procedure will last. Number 27. List the special considerations to take when drawing blood from a newborn. Since a newborn is under reverse isolation, additional protection equipment is needed. Blood should be drawn from the infant's heel. The amount collected, tests, and their frequency must be recorded to prevent blood depletion. Number 28. Name diseases that neonates may be screened for besides PKU. Number 28. Besides the PKU test, neonates are screened for hypothyroidism, galactosemia, homocystinuria, maple syrup disease, biotinidase deficiency, and sickle cell anemia. Number 29. List at least 2 common disorders associated with geriatric patients and special considerations to take when drawing blood from such patients. Common disorders affecting older adults include hearing loss, stroke, arthritis, and tremors, all of which can make blood collection difficult. Extra care should be taken appropriate to each condition. Number 30. Why is it important to rotate the collection site in a patient with HIV infection? The collection site should be rotated in HIV patients to avoid damaging veins and tissues by performing frequent draws.
Thank you for watching. Don't forget to subscribe to our channel for more content.